There's exciting news for patients suffering from knee pain, stiffness, and restricted range of motion. New state-of-the-art technology can provide you with potentially life-changing results. I sat down with our sponsor, Dr. Christopher Palmer of Signature Orthopedics, a division of Signature Medical Group, to show how he's using the ROSA Knee System, a brand new robotic technology for total knee replacements. Introducing the ROSA Robotic Knee, a new technology that's innovating knee replacement surgeries.
So with the ROSA Robotic Total Knee, they're smaller incisions. It's truly a minimally invasive total knee. There's less pain, less blood loss. I haven't had to do a single blood transfusion since starting to use this technology. Over 98% of my patients are leaving the hospital the next day, and some even the same day. People are returning much faster to preoperative activity levels or even beyond that.
Robots doing surgery sounds crazy, right? But it's not. Here's why.
A lot of my elderly patients are afraid that the robot's going to be doing the surgery, but I have control during the entirety of the surgery. And the robot doesn't actually do the surgery at all. I do the surgery.
A trained orthopedic surgeon using robotics to give patients in need a better knee.
A good candidate for the ROSA robotic knee replacement is really anyone who's considering a knee replacement. I use it on all knees that I replace because I feel like it helps me do the knee more perfectly and do it in a way that I'm able to cause less pain to the patient and get them to recover faster.
Patients like Neil Weber, who led an active life until he couldn't.
I was having just tremendous knee pain for well over a year, and called my primary care physician, and she recommended Dr. Christopher Palmer because of the new, she was like, hey, he's doing this new robotic surgery for knee surgery, and I'm hearing good things about it. So she goes, you ought to check it out. So I kind of came here and said, hey, my knee's been hurting, blah, blah, blah. He took some x-rays and found out I was just bone on my left leg. And so he's like, yeah, really the only solution is the total knee replacement. So from there, just set it up and had surgery, and it's been perfect ever since. I can't complain. And I kind of had reservations when I said, well, how many patients have you done this on? He said, well, it's brand new, just started in 2021, and I would be the 5th patient. So I was like, wow, that's, so you're like the 5th patient. At least I wasn't number 1, I kept saying to myself. And then I went home and just did a bunch of research and found some YouTube videos on it and just started hearing what other doctors from other parts of the country were saying about the benefits. And I felt really good about it.
Benefits that Neil and handfuls of other patients across the greater St. Louis area are receiving when they have surgery with Dr. Palmer at Signature Orthopedics.
The best part is going from using a standard knee replacement to now using the ROSA robotic knee and seeing the outcomes, seeing the differences that people have, seeing how much quicker they bounce back, how they're able to return to activities and even perform activities better. I've seen many patients lose weight because they weren't able to exercise at all before. Now they're able to really get up and move and do the things they enjoy.
And be able to walk every day without pain has just been fantastic. Getting in and out of the cars and just anything. It's amazing.
Amazed at how his life has begun to look normal through the gifted hands of Dr. Palmer and an incredible robot named ROSA. If you'd like more information about the ROSA knee replacement, go to signaturemedicalgroup.com/ROSA. In Fenton, Chelsea Haynes, Studio, STL.